Good morning, everybody. I just wanted to kind of kick things off and say that we're entering into a partnership with CBR. We're really excited about this. CBR is going to become our benefits administrator and our payroll administrator for the credit union. So we're really excited about this partnership, and I think you'll really like the things that you hear today. So Leticia, I'll turn it back over to you, but I just want to kind of kick things off and say that we're excited about this relationship that we're joining into.
Thank you so much, Amy. We are too. And I just want to let everybody know, obviously we have Canyon State employees on the phone. We have Alina from our office here on the phone, Beth from Delta Dental on the phone, and Trevor from ALPAC on the phone. So I'm going to turn it over right now to Alina. She's going to go over an item contact sheet that was sent via email and go over the different roles here at CBR.
Thank you so much, Leticia.
Okay. All right.
Okay, are we ready? Good morning, everyone. Thank you, Leticia, for the introduction. And I would like to start with our agenda for today. I will introduce the CBR service team, your service team at CBR, review medical premiums on the enrollment form that Leticia will be also reviewing as part of the benefits review. And then Leticia, Beth, and Trevor will review benefits in more detail. The CBR contact sheet that everyone can see on the screen is also available in the electronic format for your convenience. Lauren at the very top is your designated representative for all of your benefit needs and will assist with all aspects of benefits administration. She will be setting up your benefits deductions, assisting you with the changes, updates to your benefits, help you with any questions about the ID cards. Please use her as your resource and your benefits consultant. Priscilla will be supporting the company with the new hire onboarding, and Leticia will help Lauren and you with any concerns or escalated issues with your claims from the doctors or hospitals that Lauren may bring to her attention. So Lauren will work with Leticia very well to provide the best benefits service that we possibly can to you. Becky Vols is your designated payroll representative. She will be processing your payroll, setting up your direct deposit and tax withholdings. If you have any questions or need to provide changes, Becky will be happy to help you. We're setting up all of your information exactly the same way as it is now. So if you need to make any updates, please let us know and we can process them for you. Chris Etnier. Leticia, could you please scroll down a little bit? Thank you. Chris Etnier will be setting up time and attendance system and provide the trainings to everyone. She will train everyone who is hourly on how to clock in and clock out, and all of you who are salary will receive the training on how to request your PTO via the system. So she will be a great resource and will provide the training on the system to you. Sherry Waterman is our workman's comp specialist. You will still need to contact Amy and Marguerite immediately when you have the injury, and Sherry will be helping with any questions with the workman's comp claims as well. I would also like to review your medical premiums before I turn it over to Leticia to review them all in detail, because there are a couple of important changes that I would like to make sure you make a note of. The first change is that you currently have deductions twice a month, and on the third payroll of the month, you don't have deductions. With CBR, all deductions will be set up on a biweekly cycle. If you can see on the screen in the middle part where it says Health, Section D, all of the deductions are showing on a biweekly cycle. So you will have 26 deductions in the calendar year, and the biweekly premiums for each benefit plan are on the enrollment form, and that is exactly how much will be deducted from each paycheck. Another thing that we do differently is collect medical premiums 1 month in advance. The insurance carrier bills us on the first day of each month for that month's coverage, and June has paid for July's premiums. as we are starting our first payroll with the company in July, we will need to collect June's premiums, as July will be paying for August. As you will be able to see on the enrollment form on the screen, medical premiums are quite a bit lower, and even if we double up the deductions in July to bring everyone current, it could still be less than you might have paid for your previous coverage. If anyone has concerns about us doubling up the deductions, or if that may present any hardship to you, please let us know and we will work with you to spread over the catch-up premium over more payrolls. We will be collecting for the 2019 coverage through your last payroll in November, and December will start paying towards your medical coverage effective on January 1st. Do you have any questions to me at this time? I will turn it over to Leticia, Beth, and Trevor to review all benefits in detail. All of the benefits are effective July 1st, and Leticia will review them for you and will be happy to answer any questions that you may have.
Thank you, Alina. So we're going to go ahead and get started. Just a couple of housekeeping items before I go through the agenda and the presentation. I just want to remind everybody the call is being recorded. If you need to put us on hold or mute, if you need to put us on hold, we would prefer you mute the call. And if you need to step away, please do so. We have about 13 attendees. We want to make sure everybody can hear everything okay. With that said, I'm going to go ahead and get started. So we're going to talk about the new benefits. They are with Aetna, and you're going to have the option to for a couple of new exciting plans. So we'll go over those in detail. Dental, you'll have two options, one with Aetna and one with Delta Dental. Vision with Guardian using the VSP network. Life and disability, Aflac products, and other exciting benefits as well. Then we'll go over the forms, when to finalize the forms, when to turn them in to the team, and then we'll open it up for questions. So to get started, we're going to go over eligibility and qualifying events. So as Alina stated, these benefits begin July 1st. So once you enroll in the benefits, review everything, and enroll, you are locked in until the end of the year. So this pertains to qualifying events. So as I said, you're locked in. If you need to make any changes to your plans, to your medical plans, dental or vision, you cannot do so unless you have a qualifying event. There on the screen, you have a few examples: marriage, divorce, loss of coverage, moving outside the service area, leaving the company. Obviously, if you leave the company, you'll be covered. But those are called qualifying events. So keep in mind, you only have 31 days to notify your HR team of the qualifying event. Please do so sooner than later. If you exceed those 31 days, you do have to wait until the next open enrollment period to make any changes to your plans. Additionally, qualifications on the plans: who is eligible. You, the employer, are eligible if you work 30+ hours. Your spouse, legal spouse, domestic partner, and children up to the age of 26 are all eligible for medical, dental, and vision. Any questions? Okay, we're going to move on to the two new plans with Aetna. We're going to offer 3 different plans. The first one is the OMAC. So the network that is being utilized for all of the Aetna plan is called Open Access Managed Choice. That is the network. It is a national network. And also I want to point out that the Mayo Clinic is in the network here in Arizona and throughout the United States. So very important to notate that. So Open Access Managed Choice 1,000. 1,000 being the individual deductible. 3,000 family deductible. So you only have to worry about your deductible in a few events. If you have major services such as a surgery, a baby, MRIs and CAT scans, that's when you will start to pay towards your deductible. If you just go in for your well visits, you pay nothing out of pocket. In this plan, your worst case scenario or maximum out of pocket, which means in a calendar year in network services, the most you will pay for services is $4,000 for an individual, $12,000 for the family. Very important to note that. Because once you reach that out-of-pocket maximum, you will be into 100% coverage, which means no more copays for physicians, visits, pharmacy, urgent care, things of that nature. You will be into 100% coverage as long as you stay within the network and within a calendar year. Very important there. Moving on this plan, preventative care, as I stated earlier, in all of the plans is covered at 100%. So your well woman, well child check, all of your annual physicals, blood work that is tied to preventative, it is all covered at 100%. Office visits, if you need to go and see your physician for a sick visit, it's a $25 copay for your regular primary care physician. Specialists on this plan, $50 copay. On all of the plans, you can self-refer to specialists. You do not need a referral from your primary care physician. You do not need to contact them. You can go online, go on the Aetna website, find your own specialist, and make your own appointment. Urgent care on this plan is a $75 copay. Emergency room is a $250 copay. Now keep in mind, if you visit that emergency room and you are admitted into the emergency room for an overnight stay, they will waive that $250 and you will start to pay towards your deductibles because now you are in hospital services. A little bit different there. So keep that in mind. We want to avoid the emergency room whenever possible. Obviously, if it's loss of life or limb, you need to get to the hospital. Another very important note here for emergency room, as you can see, the copay for in and out of network for the emergency room is the same. Wherever you travel within the United States, if it's a true emergency, you will be treated as in network. Very important to note that. Additionally, with this plan, you have 30-day retail supply for a couple copays you can see there at the bottom. So your generic is either going to be a $3 copay or a $10 copay. If you have the guide in front of you that was sent electronically, you will see a $3 copay. It should say 3 or 10. Preferred brand name is a $35 copay, and non-preferred brand name is $60 copay. Specialty medications is 25% up to $250. Your specialty medication are things like injectables. Those are high ticket items. Mail order, you have access to a 90-day supply for 2 copays. So if your doctor can write you a 90-day prescription, you can send it in and you get 90 days worth of medication for 2 copays. So you save a little bit of money there. You do have out-of-network benefits with all of the plans. I recommend you stay in the network whenever possible. You will have a lot higher out-of-pocket expenses if you go out of network. Like I said, the Open Access Managed Choice is a national network, contracts with a lot of physicians, hospitals, standalone clinics, and specialists here in Arizona and throughout the United States. Any questions on the Open Access Managed Choice 1000? Okay, we're going to jump right into the second plan. This is the Open Access Managed Choice 2000. So 2000 being the individual deductible, 4000 being the family deductible. Again, the out-of-pocket maximum on this plan is a little bit higher, $6,350 and $12,700 for the family. Your copay for your regular doctor visit is $30. Your copay for your specialist is $60. Urgent care is a $75 copay, and your emergency room is $250. Your prescription is exactly the same as the other plan, $3 or $10, $35 for your preferred brand name, non-preferred brand name, $60, and your specialty medication is a 25% up to $250, and again, same mail order. Now, 2 different plans, which plan is best for you really depends on your current situation or the life situation. Do you want to pay more per paycheck and pay less at the point of service if you're having surgery or family planning? Those are things to consider and think about when you're viewing all 3 of your options. The last plan that we're going to go over is the Open Access Managed Choice 3500. This is a high deductible health plan, which means everything goes towards your deductible with the first visit. So the beauty of this type of plan is you compare it with a health savings account. Pre-tax dollars that you put aside into an account that you own, your money, you use it for your medical expenses. Not only medicine, dental, vision, surgery, LASIK, medical equipment, things of that nature. There's a pretty big list of things that you can use it for. Also, yoga and Pilates and chiropractic services are included in that. So we're going to run through this plan really quick, and then we're going to talk more about your health savings account that is tied to the high deductible health plan. Again, this is an open access managed choice, $3,500. $3,500 being the individual deductible, $7,000 being the family deductible. Your out-of-pocket maximum here is $5,950 for an individual, $11,900 for the family. Keep in mind all of your co-pays, everything that you swipe your HSA card, everything that you pay the doctor, as long as you show your ID card, goes towards that out-of-pocket maximum. That is true for all of your plans. So your co-pays for your physician, your co-pay for your pharmacy, your co-pay for your chiropractic services. If you have a surgery, obviously deductible first, but all of that goes towards your out-of-pocket maximum. So you may want to look at your current explanation of benefit with UHC. If you have met any part of your deductible, I would highly recommend you print that last explanation of benefit, or if you receive it via the mail, U.S. mail, and email it to me, and I will make sure Aetna receives it. They are giving everybody deductible credit until the end of the year, so you don't have to start all over with that deductible. If your physician now is within the Open Access Managed Choice Network, that would be amazing because you can continue your services or your treatment that you have now without having to re-meet that deductible. So keep that in mind, especially if you're on the health savings account. If you use those dollars towards that deductible, get that explanation of benefit to me as soon as possible so I can make sure you get that credit. Finishing up with this plan, everything is deductible first, including pharmacy. There on the screen, you'll see a little orange box. It says some items available before the deductible. They are medications, so maintenance medication and contraceptives, excuse me. So contraceptives and maintenance medications are available prior to the deductible. Not every single one. So if you have a medication that you'd like to find out if it falls in that category, you can email me and I will check the formulary and the FDA list. And if it falls in that category, you do not have to pay anything for that medication prior to your deductible. Okay? Any questions on the high deductible health plan? Okay. Now we're going to talk about health savings accounts. So health savings accounts are paired with a high deductible health plan like the one we just reviewed. So these are pre-tax dollars that you set aside. The pre-tax dollars help in lowering your taxable income. So that's less money that the government taxes and more money in your pocket. So we do partner with UMB. UMB is the account holder. They will send you out a Visa debit card once you open your account. Very important there, that you must open your account before we can start to put funds into that account. The company does contribute towards your health savings account. So if you sign up for the high deductible health plan, we need you to open that account as soon as possible. We will get notified that the account is open and we will start to transfer that money into that account ready for you to use. So again, just going over the health savings account, there are some IRS limitations as you can see on the screen. If you're an individual, the most you can set aside is $3,500. As a family, $7,000. So under IRS rules, a family is considered one plus, which means one plus a child or spouse. So make sure you keep that in mind. Now, if you're enrolling in the high deductible health plan and your spouse or domestic partner is also enrolled in a high deductible health plan, make sure you coordinate your maximum contribution. If you exceed that $7,000 when you file taxes, that excess of $7,000 will be taxed at 40%. So very important there to keep that in mind. Additionally, if you're 55 plus, the IRS has something they call catch-up provision, which allows you to add another $1,000 on top of that $3,500 or on top of that $7,000. So you have the ability to do that. The reason the IRS does that is because once you reach Medicare age and enroll in any part of Medicare, you can no longer contribute to a health savings account. You can utilize the funds. You can even utilize the funds to pay for Medicare premiums. You just cannot contribute towards an HSA. So very important there, and that's why they allow that $1,000 catch-up. A few of the things that I want to point out with our partnership with UNB, once you reach $1,000 in that account, you can start to invest the money. Any interest earned is also tax-free, so very important there. And then similarly to a 401k, when we reach retirement age, we can start to access those funds in a health savings account, and that money is also tax-free. So this is truly a triple tax savings vehicle, the only one in the U.S. that I know of today. So again, the money is yours. It goes with you. If you leave the company, that money is yours. You own it. There is no use it or lose it provision. You can use it for all medically qualified expenses. If in 2020 you decide not to enroll in a high deductible health plan, you can still utilize those funds for medically necessary items such as pharmacy, co-pays, dental work, braces, vision, glasses, LASIK, things of that nature. You can still utilize that money. Okay? Any questions on the high deductible health plan or the HSA? Okay. Next, we're going to move on to another tax saving vehicle. This is called a flexible spending account. So we have two types. We have a medical FSA and a dependent care FSA. The medical FSA, if you are enrolling in the high deductible health plan, that is paired with an HSA account. The other two medical plans, Open Access Managed Choice 1000 and the other low deductible health plans, those can be paired with a flexible spending account. So keep that in mind when you're enrolling. Again, these are pre-tax dollars that you elect that go into a Visa debit card that you receive in the mail. And you can utilize this money for pharmacy, vision, dental work, etc. Again, this is paired with the first two plans that we went over with. So again, pre-tax dollars, you can maximize it at $2,500. Just keep in mind that we will debit the amount from your paycheck per pay period. So if you want to go ahead and enroll in $2,500, you'll have that debited from your paycheck till the end of the year. If you elect a lesser amount, that we'll calculate that based on how many pay periods are left. Very important to note that when you are making that selection of how much money you want to set aside, that by December 31st, 2019, the maximum you can roll over into 2020 is $500. If you exceed the $500, whatever amount is in excess, you will forfeit. So very important there, we're making your calculations of how much money you want to set aside and how you're going to spend it. Okay, the other account is a dependent care FSA. So again, pre-tax dollars that you set aside for children, daycare, day camp, or elderly care. Pre-tax dollars coming out of your check, and this money is utilized as it's deposited into an account to pay yourself back or pay your provider. It is not front-loaded like the medical FSA. Any questions on the two flexible spending accounts? All right, next we're going to jump into telemedicine. Aetna partners with Teladoc, so if you enroll in Aetna, you will have access to the telemedicine. These are board-certified physicians available 24/7, 365. So you can have your regular general medicine visits, and the copays range from $35 to $40 depending on which of the three plans you're enrolled in. If you are enrolled in the high deductible health plan, your general medicine copay is $40. Just note that. So they can treat anything like pink eye, rashes, colds, flus, allergies, UTIs from anywhere. 24/7, 365. If you can get to a telephone or Skype with a provider, they can send a prescription to the pharmacy that's most convenient for you. So very important. Aside from general medicine, they also offer dermatology, and the copays range from $50 to $75. $75 being for that high deductible health plan. They also have behavioral health visits, and those range in price. So we provided some information in your benefit guide that has information on how to sign up for Teladoc, and there's also a website there on the screen. I recommend that once you receive your Aetna ID card, you log on to that website, you enroll, you put in your HSA account or your SSA account or form of payment because they will want that information. And then you can download the app to your telephone and you have it ready to go when you need it. So the last thing you want to do is be scrambling to try and set it up when you actually need the services, when you have that, child with the earache, the pink eye, or trying to get better. So make sure you take care of this prior to utilizing the services. Any questions on the telemedicine with Teladoc? Okay, next we're going to go over your two dental plans. I'm going to go over the Aetna DMO, and Beth from Delta Dental will go over the Delta Dental benefits. So the Aetna DMO is what we call the base plan. It is with the Aetna DMO network. So I do recommend that you go online, and I believe everybody has a benefit guide and has some instructions on how to find a provider. That you need to find a provider, and you need to, I would recommend calling them as well, make sure they're still within the network. Additionally, once you pick a dentist in the DMO network, you have to stay with that dentist. They will coordinate all of your care. This plan does not have an annual deductible. It does not have an annual maximum, so you don't have a set dollar amount to utilize towards your services. You can utilize it the entire year without a limit and no deductible. So your preventative services, your cleanings twice a year, and your x-rays are covered at 100%. Your basic services, such as a filling, is covered at 90%, and the member picks up 10%. Major services, such as a crown, it's a 60-40 split. So Aetna will pick up 60% of the cost, and the member picks up 40% of the cost. Again, no annual maximum. This plan does have an orthodontia benefit for children. It's a $2,400 one-time copay by the member, and then Aetna picks up the rest. You do have to stay enrolled in the program along with your dependent for the duration of the plan, which is about 24 months. Any questions on the Aetna DMO before I turn it over to Beth? Okay, Beth?
Okay, can you hear me?
Yes.
I can hear you.
Oh, okay, perfect. Good morning, everybody. Thank you for having me on the call. And what I want to do is go over the Delta Dental PPO plan. And the first thing I want to do is point out the main differences between the DHMO plan and the Delta Dental PPO. On a DHMO plan, you are required to select a dentist, and you must utilize that dentist for all your care. If you go outside of that dental network, then you have no coverage through the Aetna program. If you need to go to see a specialist like a endodontist or a periodontist, you would go through your primary dentist and they would refer you on if necessary. So the main difference is on the Delta PPO, we don't have that restriction. So you can go to your current dentist that you're seeing and or any other dentist within our network, or you can go to dentists that do not take part in our network. Although Delta Dental does have the largest network in the state, we have about 98% of the dentists on our network. So I don't think your dentist will not be in the network, but just in case they are not, you're still welcome to see that dentist. The way that our preventative services work are similar to the program with Aetna. You go in and get your teeth cleaned twice a year and exams, and we'll pay for those at 100%. And just to note, this program runs on a calendar year, and you guys are starting July 1st. So everything I'm talking about, you have these benefits from July 1st to December 31st, and then everything starts back over at zero again January 1st. So on the exams, you could literally go July and get your teeth cleaned and go in August and get your teeth cleaned if you really wanted to, and it would still be covered. Your x-rays are also covered at 100%. Those of you who may have children on the policy, our plan has very rich benefits for kids. Your fluoride, your sealants, those are covered. Fluoride up to age 18 and sealants up to age 19. Most plans only cover those things up to about age 14. So you go into the dentist with your kids and they may be 16 or 17 years old, and the dentist says, hey, we're going to do fluoride, you say great, and then all of a sudden you end up paying for it because it's not a covered benefit. Ours covers the fluoride to 18 and the sealants to 19. If after those exams it's determined that you have a cavity and you need to have your filling done, those are paid at 80%. So Delta will pay 80% and you'll pay 20% of the cost. We also have endodontics, which is root canals, and periodontics, which is gum disease, as well as simple extractions through an oral surgeon. Those are also covered at 80%. So we'd pay 80% of the bill and you pay 20%. On your major services, those are going to be your crowns and bridges and dentures, as well as implants. We do cover implants under our policy. Those are a 50-50 split. So Delta will pay 50% of the cost and you'll pay 50% of the cost. One thing I do want to point out is when you do see the Delta dental dentists that participate within the program, they have a contracted rate. So again, I use my husband as an example. He had to go in and get a crown. The billed charge from the dentist was like $1,300, but the dental agreed upon contracted rate was only about $700. So we were paying 50% of the $700. The dentist writes off the balance. This plan covers orthodontics for adults and children. So orthodontics are covered at a 50-50 split, and Delta Dental will pay $1,500 towards the cost of the orthodontic benefit. On the, if everybody has the summary of benefits, I'm not sure if they do, but you'll see that it's also on the screen, the annual maximum of $5,000. So that is what Delta Dental will pay in a given year, is $5,000. And what I want to mention about that again is that the plan runs July 1st to December 31st. So you technically have $5,000 to spend between July 1st and December 31st. And as of January 1, you have a new $5,000. So you can really get a lot of work done. And if you plan accordingly, and you could almost have $10,000 worth of work that you can get done between the end of 2019 and then 2020. So again, the main difference you want to keep in mind is that on that DMO plan, you are restricted to only use the dentist within the DHMO network, and it is a much smaller network than the network we offer. On the Delta Dental plan, it's a PPO. You're free to use any dentist, and the benefits are the same, regardless of whether the dentist participates in the network or not. Any questions on the Delta Dental plan? Oh, one thing also, we do mail out ID cards. So you will receive a Delta Dental ID card. It comes in the mail along with some other literature from Delta Dental. So if you see something, don't just think it's trash and toss it. At the bottom of all of the information is going to be an ID card that you'll pop out and put in your wallet. Any questions?
Thank you very much, Beth.
You're welcome.
If you have not received the PDF version of the Delta Dental Benefit Summary, we'll make sure that you receive it. There's also additional information located at the office. If you're at the office, you're going to be going to the main location. We left some flyers there, and they'll be available in the next 2 meetings as well. Next, we're going to move to the Vision Plan. So this is new, and it is with Guardian using the VSP network. So a pretty straightforward plan. You have access to your exams every 12 months at a $10 copay. Your frames every 24 months. You have a $130 allowance to use towards your frames. And then you have a 20% discount if your balance is over $130. You can also use your flexible spending account or your HSA dollars to pay for those frames and glasses. Your lenses are every 12 months, single vision, bifocal, and trifocal, and lenticular are covered as 100% after a $25 copay. And if you wear contact lenses, conventional or disposable, you have a $130 allowance to use towards that benefit. And medically necessary contact lenses are covered at 100%. So VSP, when you go online, search, you can go directly to VSP online and type in your zip code and it'll find providers that are closest to you. If you go onto the Guardian website, it will direct you back to VSP. So make sure you know that that's going to happen when you go onto the Guardian website. Also that you do have some out-of-network benefits with the Guardian VSP network. However, how that works is you pay the money up front and then you submit your claim to Guardian and they will reimburse you a dollar amount. Any questions on the vision plan? Okay. Next, we're jumping into life and AD&D. Everybody should have received a packet specific to them. The company is offering life insurance and disability to all of the employees. And this is, again, very specific to each employee, so everybody will receive a different packet. If you have not, please reach out to your HR team and they will send you a packet either electronically or a paper packet. Additionally, outside of the life insurance that's offered through Guardian, we also offer life insurance through UNUM. And the UNUM policy is a little bit different. It is guarantee issue right now. I think everybody has a guide that has that information in it. The guarantee issue with UNUM is $200,000. What does that mean? The guarantee issue means you won't have to answer any medical underwriting questions. You won't have to do any blood work, anything like that. The amount listed on this screen is incorrect. It should be $200,000, not $175,000. So keep that in mind. 5 times annual income of $200,000 guarantee issue, $25,000 for spouse, and $10,000 for the children. That is all guarantee issue. So even if you enroll this time around in $10,000 of life insurance for yourself, that'll give you the opportunity to continue to increase that amount up to the maximum of $200,000, again, with no medical underwriting. So let's say this time you do $10,000, next time we come out and do an open enrollment meeting, you want to increase it to $50,000, you can do so, again, no medical underwriting. If you decide not to enroll in any amount of the voluntary, then you will have to answer some medical questions if you enroll even in the minimum of $10,000 next time around. So keep that in mind. The prices were sent out. There's some packets that I'll go over online right now, and then we also sent them electronically. If you don't have them and would like to have them, please reach out to your HR team, and I will make sure that I get it to the HR team so it can go to everybody. It's very inexpensive. I picked on the youngest person in the room last time I was there. It's 68 cents a month of $10,000 of coverage for somebody that's 23 years old. The prices do range on the amount that you want to enroll in and your age, so we'll go over that shortly after the presentation. So I highly recommend that. And then we're going to go over the EAP program that's available through Guardian. It's through Work Life Matters. Again, this is free to all of the employees. You do not have to enroll in anything to take advantage of the EAP. It is a free service because the company pays for the life insurance and the disability through Guardian. So this is free to everybody. Everybody should have some information on this. If you do not, again, reach out to us and we'll get it to you. So you have a 1-800 number to call. You have some face-to-face visits, some telephonic consultations. They can help with pretty much anything, you know, a 2-year-old that's driving you crazy, elderly care, financial consultations, debt consolidation, divorce. They can help you through that, some education questions and how to pay your student loans and all that good stuff. So a lot of good referrals with this program. There's some information there on the screen and also in your benefit guide how to access the services. You can access them online, go through their library of services, pick up the phone, give them a call, and they will be happy to assist. Next, we're going to go over some of the products that AFLAC offers, and I believe we have Trevor on the line, and he's just going to speak high level with some of the options that are available. Trevor, are you there? Maybe he's having audio problems. I know he's on the line because I can see him. Just 1 second. He may be having some, he can't unmute. So let's see if I could unmute him somehow. I do apologize, not sure what's going on. So I'll just speak briefly. I know that Trevor is making a point to come back out and meet with everybody individually. I know some of you already have the AFLAC products, so he wants to sit down and meet with everybody individually, either if you do or do not have the AFLAC products, because there's some exciting changes. When you come onto CDR, our rates may be a little bit lower, so it's a good time to evaluate those plans and see what best fits your family at this time. So as you can see from the screen, the different plans that AFLAC offers, their accident plan, hospital choice plan, the cancer plan, and within that there are some different variations, the critical illness and the plus rider, and of course they do also offer, that's not on this screen, is disability products like short-term disability, and they have some different options available to everybody there. So I'll make sure that Trevor it reaches out to everybody in either telephonically or when he comes back into the locations and sets them some time to go over the products that you currently are enrolled in, and then visit with him on anything new. Again, I apologize for the technical issues. We're going to move forward with the other plans that are available. So we have pet healthcare through United Pet UPC. So United Pet Care, I apologize, that is available to all the employees. It is a voluntary program. You enroll online. Everybody should have some information on that. If not, like I said, this presentation is being recorded and we'll make sure everybody gets it to follow up on any of the links. So it depends on how many pets you're enrolling. If you're enrolling 1, 2, or 3, and it doesn't have to be cats or dogs, it could be anything. Gerbils, ferrets, snakes, potbelly pigs, horses, anything like that. So I have my personal dog, my dog enrolled, and you know, she got her physical, got her shots and some vitamins, and then they put her on a diet. So my poor dog. So we have a checkup in another 6 months to see how she's doing. So a really good network here in Arizona and throughout the United States. If you currently have a doctor or a facility that you visit, they may be part of the UPC network. They also offer really deep discounts on pharmacy. So I know a lot of our coworkers here, their pets are on different types of medications. They receive some significant discounts on tick medication and allergy medication. So really good to look into. And again, we provided some information. If you don't have it, we'll get it to you. The other thing we offer is Legal Shield and ID Shield. So we have some legal consultations there. They assist with your standard will preparation. They can help draft letters to whomever you need to draft a letter to, legal issues. They can help with all of that. And then the ID Shield has 24/7 monitoring of your credit. They also help in restoring your identity if you've been a victim of identity theft. So really good program, and we provided a flyer with the cost for that. And then there's a website you go to enroll. And then both of these items here, the pet healthcare and the Legal Shield and ID Shield, are all payroll deducted as well. So we're going to open it up for questions now, and then we're going to go over just a couple of things that need to come back to your HR team by the deadline of the 21st.
I know that this has been a lot of information, so please don't be afraid to ask questions. This is a great opportunity to do so.
Yes, absolutely.
Hi, I have a question regarding the HSA. So I currently have an HSA. Does that money roll over into this new HSA?
Yes, it will. It will be transferred over. It can be transferred over to UMB. It does not have to, but it can be.
Okay.
You would have to initiate that. Once you get UMB set up, you would have to go get with Health Equity and initiate the rollover.
Okay.
Correct.
I have a question regarding the dental. Is there going to be, or is there a form that breaks down the descriptions under each category, like basic and all that, so we know what it actually does cover? Like what a bridge is, what a crown is, what a root canal is. Like, is there like an explanation? Is it so we know if it's a basic or a?
Yes. This is Beth. This is Beth with Delta Dental. We do have a benefit summary. I just sent it over to Leticia, so she should. There's also some at the office. I left some over there yesterday when I was there, so you should have access to that probably shortly, as soon as she sends that the PDF over to Amy.
Yeah. Once I get it, I'll make sure to send it out.
Thanks, Amy. And then the other question I had, I just wanted to understand a little more about, you talked about if our dentist is part of Delta, and you were saying something about like there's a certain preset amount. I wasn't really sure. So, for example, you said the crown was like $700, but it might have been $1,300. Like I was a little confused. Can you just kind of repeat that a little bit to clarify?
Yeah, absolutely. So, yep. So the dentists have a what they call a contracted rate.
Okay.
So, and it's kind of the same way with medical doctors. If you've ever looked at a bill from a medical doctor, sometimes it has some crazy, dollar amount on it. But then after the insurance company processes the claim, there's a contracted rate that the doctor agrees to. So the dental works the same way. So if a dentist, for instance, maybe bills, $1,500 for something, for a crown, for instance, don't assume that you're just paying 50% of whatever he bills. When they're a Delta Dental dentist, they have a contract with us. So they've agreed to a specific fee, and you are only paying 50% of that fee, not the entire dollar amount. So, and I just used those dollar amounts as examples because my husband actually just had a crown. So when you actually looked at the bill that the dentist billed Delta Dental, it showed like $1,300. But because they are contracted and had a contracted rate with us, then that $1,300 was reduced down to $758 or something like that. And then our 50% was based on that reduced amount, not the original billed amount. So it works, like I said, the same way as a medical. Sometimes you can look at a medical bill and, it says it's a $40,000 hospital bill, but when all is said and done, based on the agreements that the providers have, that is reduced down to a contracted rate that they have with the facility.
And will we just ask them if they are contracted, or would we be able to know that?
Well, you can either or. So you can let them know. You can call your dentist and let them know that you are moving to Delta Dental, and you're on the Delta Dental PPO, and just ask them if they're part of our network. You can also go right online, and I left some information there at the office of that as well. It's deltadentalaz.com, and then from there, I'm just going to hop on here and tell you exactly where to go to look for it.
And when I'm going to be sending out the document here in just a few minutes, and it's included on the website.
Okay. There. Okay, that's good then. Okay.
Yeah.
I received it. I just want to point out, where's the website information? That's on the, yes.
Yes. If you go down to stop. Right at the bottom here, you see where it says member connection, deltadentalaz.com.
Yep. Okay, perfect. Thank you.
But if you scroll up, Leticia, you'll see where it talks about the basic. If you stop, the basic services, you went up too far. Endodontics, which are the root canals, and periodontics, which is gum disease, those are at 80%.
Yeah, Amy, did you get the PDF?
I did. I just sent you an email back asking if you had one for the Aetna DMO too, and then I'll send them both out together.
Yes, I'll send that over to you as soon as we're off the call. So I'll send, you know, great information, great questions. Anybody else have any other questions? This is your opportunity to ask us any questions that you'd like. You know, if you want to ask questions outside of this platform, you can. You can email me directly if you want to go through your HR team. You can do that as well. Either way works. We're here to assist and answer any questions before you make your decision. All right, so just a few more things to go over here. So what everybody sees now on the screen is their enrollment form. So the only two mandatory items that your HR team needs is this enrollment form and your guardian life insurance beneficiary form. Very important there. So if you already have the life insurance that's covered by the company, everybody received a beneficiary form that needs to be completed and back to HR. This enrollment form also by the deadline of the 21st. If you get it to them today or tomorrow or early next week, that would be awesome. We need it so we can process everything and send everything to the carriers. So everybody has their ID card as close as possible to the first of the month. Okay. A couple things I want to point out on your enrollment form here. Towards the middle in section B, that those are your biweekly premiums. So keep that in mind when enrolling. Additionally, if you were enrolled in a health savings account before and you have set aside the IRS maximums already, keep that in mind when you're enrolling in the plans. You don't want to exceed that $3,500 for an individual or $7,000 for the family. Take into consideration what the company is providing for each employee if you enroll in that high deductible health plan. So you must subtract that amount from your maximum. So if you're just enrolling for the first time, the amounts listed in red are per pay period. So make sure you calculate that along with how much you are contributing. So again, make sure you open up your UMB account so we get notified and we can start to put away those dollars for you. If you are not enrolling and you're waiving and the benefits, Section E and F of the enrollment form must be completed and turned into your HR team. The next enrollment form is a task enrollment form. This is for your flexible spending account, both your medical and dependent care. If you're opting out, you don't need to do anything with this form. You can toss it. The next form is the Unum life insurance form. Again, if you're enrolling in that voluntary life insurance program, this is the one that needs to be completed. They'll need all your information on here. And then the back of the form is your beneficiary. Make sure you update that information as needed, both with your guardian life insurance policy and if you're going to be enrolling in a voluntary life insurance plan. So if you enroll this time around and in 2 months there's a change in beneficiary, make sure you contact your HR team right away so they can update that information. If you sit in a community property state, such as Arizona, your legal spouse is automatically your beneficiary unless your legal spouse signs an affidavit saying they waive that right. Additionally, if you are enrolling in the Unum life insurance and this comes back blank, I will add my information on there. I will be your beneficiary, so make sure you get that updated. And these are the rates for the life insurance. I was saying earlier, a 24-year-old, 68 cents for $10,000 of life insurance. If you do not have this price sheet, let me know. We'll make sure we get it to you. It's very affordable. It is a large group rate. Additionally, it is portable. If you ever leave the company, you will be notified that you have the right to port the coverage. It will change to a whole life policy. after a few months of being enrolled as a group plan. So keep that in mind as well. All right, the next form is the Legal and ID Shield. These links here are live. We'll make sure that everybody gets this as well. You can go online, enroll, and we'll get notified, and it'll be payroll deducted. These are the rates if you want to do a combination, if you want to just sign up for the Legal Shield. And these are monthly costs, so you know you're biweekly, so it'll be half of that, or times 12 divided by 26, so you get a better calculation if you do it that way. And then the last form that I'm going to go over is the United Pet Care, or UPC. Here are some examples of co-pays, of what is covered, where it's covered, and it's really rich here in Arizona and California. They do have providers all throughout the United States. Additionally, if you have a provider that's not with UPC, you can send a referral to UPC, and they will reach out to that physician or that doctor or that center and see if they want it to be part of their program. So they do that on a regular basis. And then I'm just scrolling to the bottom. You can see the cost there. So one pet, $10.60. And these are, again, monthly deductions of your paycheck. The link here is all you need to click on that. You enroll, we get the notification, and it comes out of your paycheck bi-weekly. Any questions on anything we've gone over so far? Just reminders, the deadline is the 21st. Please complete the enrollment form, whether you're enrolling or waiting, we need that back. And then the other form we need back is your guardian form with your beneficiary. Anything else? Anything you'd like to add, Amy?
Nothing from my end. You're always welcome to reach out to Marguerite and I with questions. We're happy to help. If I think most of the forms, other than the 2 dental SBCs, have been sent over to you. I'll get those dental ones out to you here shortly. But you should have everything else. If I miss something, please don't hesitate to call me out on it. I'm sure I can get it for you.
I have one thing. I have some goodies at my desk from Delta Dental, and then the screen cleaner. So I'll get those over to you guys. Some dental floss and a bright green toothbrush too.
Great.
Yeah, if you're interested in dental floss, a toothbrush, or a eyeglass cleaner, let Marguerite know and she can send one over to you.
All right. Awesome. Thank you so much. We're going to create a YouTube link that will go out to Amy and Marguerite, and then they can distribute to the team.
Thank you so much, everyone.
We appreciate it.
Thank you. Have a great day.
Bye.
Thank you.
Thank you. Enjoy your day.
Thank
Bye.
you.